Good afternoon, everyone. My name is Christina Starr. I'm on the marketing team here at Provider Trust, and I'd like to thank you for joining us for today's webinar. Today, we are going to be talking about the recent regulatory updates and compliance standards. If this is your first webinar, we are Provider Trust. We believe that a smarter healthcare makes a safer healthcare. We do this by monitoring your healthcare populations to identify compliance and credential issues before they impact patients. For those of you who haven't joined our webinars before, I'd like to introduce today's presenter, Mike Rosen. Mike is the co-founder of Provider Trust. He has 30 plus years of experience in compliance and has been legal counsel to several large organizations here in Nashville. With that, I'm going to turn it over to Mike to talk us through today's agenda.
Thanks, Christina. Welcome, everyone. Hope that this finds you well in our COVID days. Christina and I are actually brave enough to come into the office and try this in person, but we are socially distancing. So hopefully the sound works. If it doesn't, please let us know. You're encouraged, by the way, to ask questions through any of the chat abilities here. And just if you cannot hear or have any issues, please let us know as we use technology to our benefit. Today, we're going to talk about 4 areas that we think you should be made aware of and provide you with some links in the event that you'd like to learn more detail. We're going to cover quite a bit of ground, so if I don't get to any detail, please feel free to ask or click through the links when we send the PowerPoint after today's presentation. We'll focus on what's happening with HHS OIG. We'll talk a lot about telehealth expansion because of COVID-19. That is topic of the day. We will talk about COVID-19 and DOJ guidance that may help you assess the effectiveness of your compliance programs. So we'll start with HHS. Interesting times bring about interesting times. So HHS actually, which has at the OIG level not had much turnover at all, for a number of years, close to a decade, has had quite a bit actually in just the last few months. Daniel Levinson resigned in April. There was an interim acting OIG, Joanne Chetty, if I pronounced that right, but she has retired at the end of December of 19, and Christy Grimm assumed some interim responsibility until most recently in May, when the Trump administration nominated Jason Wida, who comes from a legal background, obviously, U.S. Attorney's Office in Boston, quite a bit of healthcare experience in False Claims Act, which would be a good person to have in that role, and has been nominated, not yet approved, but as permanent OIG replacement for Daniel Levinson. So quite a bit of movement has been there. That does not, however, mean that the OIG has been silent or not active during this period of time. And we're going to talk about some of the things that they have been working on. In May, of course, all of these which we're highlighting pretty much in the work plan have to do with, no surprise, COVID. In May, there was an audit of nursing home infection prevention and control programs and deficiencies that the OIG had highlighted. If you're in that sector of healthcare, worth taking a look at. There was also an audit of the CARES Act, which had recently been enacted, and some of the distribution of the $50 billion to healthcare providers that had started because of COVID. In June, there was a release of the work plan, a review of Medicare data to understand hospital utilization during the pandemic. Obviously, that will continue to be updated and probably is already outdated. If we're in August, June's data is probably not even applicable. But at the same time, the OIG continues to focus and be worried about opioid treatment. And unfortunately, during these times, there has been quite a bit of press about the increase in substance abuse and the reliance upon opioids, which were already a problem, increasing during obviously very stressful times. And so this issue is not going away. July, they added Medicaid review and did an expedited provider enrollment review. They're in the midst of doing such during the pandemic. So that'll be very interesting to see where that comes. That is a focus that the OIG, I think, will probably make more permanent, at least for the next 12 to 18 months. There's a geographic distribution of relief funds to communities that were disproportionately impacted, primarily the rural communities. And then, of course, use of Medicare telehealth services, which we're going to talk a lot about the rest of today. So if you have any questions or would like to see what they're focused on, there is a link that you'll be provided and you can click through. That's what the work plan updates have focused on. Now, the OIG administrative enforcement, do not be lulled into thinking that because of COVID and everything else that's going on, that the OIG is not moving forward on administrative enforcement. They continue to do so. They just do it like we are, remote. The same investment in people and resources exists at the enforcement levels. They're just not physically in the office to do so. There are some links here to the inquiries for enforcement authorities during COVID. There is a little bit of leeway given to providers during this time frame, but not to the extent that they will allow kickbacks and inducements and stark violations to not be pursued. So do not take this as a chance to drop your dukes and not focus as you have been and should be in this area. There is a COVID-19 portal that OIG has come up with. It's actually pretty good. There are quite a number of resources and links and shared resources for you. Everything from policies and procedures to infectious disease best practices, emergency preparedness and toolkits. So if you haven't been there, I suggest bookmarking it and going there. It is actually updated quite often by the OIG. So we've talked about telehealth. Let's talk a little bit more about what specifically happened early on and bring you up to speed on the influx as well as adoption of telehealth. No surprise that healthcare has been moving towards telehealth pre-COVID anyway, because of technology and because of the ability to provide care across the board, not necessarily in person. Now, this got expedited exponentially with COVID starting in February. And so the first thing CMS did was address and issue some waivers. They broadened the access to telehealth services so that beneficiaries could receive care through that technology for a wider range of services. There had been services allowed before, but now there are many more that are reimbursable. And this allows doctors and nurse practitioners and licensed credentialed providers to provide healthcare telephonically or over the internet. CMS is expanding this benefit on a temporary and emergency basis under their authority under Section 1135. They have actually extended the waiver another 90 days, and I suspect we'll be seeing multiple of those until a vaccination is released. So do know, and you've probably experienced, that telehealth is not only here to stay, but is allowed and reimbursable. So in April, 43.5% of all Medicare primary care visits were done through telehealth, which is actually really a good thing. Myself, having parents who are in their 80s, it's really helpful for them if they don't need to get in the car, especially during these times, and see a doctor, but be able to speak to someone and embrace the technology. So not surprised to see Medicare visits up. Virtual check-ins and e-visits and other software providers are really jumping onto the bandwagon here. Now, that being the case, exponential growth of telehealth, there are some risks and some opportunities for fraud, and we'll talk about those. But first, HHS issued a report on Medicare telehealth activity. This, to me, was fascinating. Prior to the public health emergency, this was just 6 months ago, 14,000 beneficiaries received telehealth services weekly. Today, and this number is probably already outdated, it's over 10 million weekly visits and through the period of March through July. And so the number has exploded. The technology has enabled it to do so. But there's also been some confusion and some focus by the OIG as well as CMS on making sure that proper care and services are being done, not through abuse of the service. We'll get to that in a minute. There was a rollback of telehealth payment and location restrictions that allowed for the growth. Medicare will reimburse more broadly. It actually now has 135 plus, because this slide was actually written 2 weeks ago, telehealth services that are covered by Medicare to almost 40 million beneficiaries, and that number should grow, both in beneficiaries and services that are allowed. And no surprise, and to the benefit of telehealth, rural health is the focus of the OIG and CMS. The administration has issued an executive order in this area to actually improve access and quality to rural health. And if you're following the pandemic spread, you're seeing that telehealth has moved, or excuse me, the pandemic concentration hot zones has moved out of some of the larger cities and now into the rural communities. So what better time to have telehealth available than today? So lots to talk about in that regard, and you can come back and take a look at that. We'll talk about COVID itself. There's lots to talk about. As we mentioned, there has been an issuance, an executive order of a public health emergency that has been extended by Secretary Azar. The Secretary did extend it in July for 90 more days. This allows increased Medicaid funding. It allows telehealth service expansion and funding. It addresses hospital benefits and flexibility, which continue. You're beginning to see elective surgeries coming back, things of that nature based on some of the actions states have taken. There are less restrictions on care and reimbursement than there had been in the past under this emergency extension, and will continue each of the 90 days they are extended. There is quite a bit which we can talk about, and there's a link on our website as well as in the presentation about waivers and license portability for certain states. This is important because care is now being provided by practitioners in another state through telehealth and allowed to do so, but states had to catch their state regulations up to allow those providers to do so outside of the state in which they're potentially residing or practicing. So that is an ever evolving, most, if not all, the states have now enacted them. But there is a link on our site if you're interested in specifically your state, how long that extension is, what are the parameters, and what license issues you need to be aware of in your state based on your state's regulations. This also has been covered by state medical boards. They have provided updates, and those reviews are available through the link and on our site for your perusal. We're going to talk about CMS updates and releases. This is as of August 17th, so fairly recent, a week old. CMS audits are resuming. They were sort of put on hold to allow everyone to deal with the unexpected pandemic, but they're back. CMS will resume routine inspections of Medicare and Medicaid certified providers and suppliers. And I want to highlight suppliers because we're going to talk about some of the fraud that we're seeing in the PPE space that both CMS and OIG are focusing on. And this, of course, is done to improve the safety and quality of patients. The resumption of on-site revisit surveys is back. So they were put on hold for a while, but if you were under a schedule for a revisit, they're resuming this. And for non-immediate jeopardy complaint surveys and annual recertification surveys as soon as they're available. So just know that these are not now held in abeyance. The CMS has provided some guidance on resolving enforcement cases that were previously on hold because of survey prioritization changes. And so if you're involved in those, they're coming back. And expanding the desk review policy when state surveyors ensure that facilities return back to compliance with federal requirements, but without on-site surveys. So I don't know if this affects some or all of you on this call, but do know that CMS is going to, as best they can, from a remote and on-site visit, come back to these audits in a lot of cases. There's a toolkit for those of you in the nursing home space about mitigating COVID-19. Obviously, this is an ever-evolving area and one that's a big focus of CMS because they want to produce as much as possible to help everyone equally about knowing what are best practices. There's a link in our presentation you'll see there if you would like to click through. Okay, so we talked about some of the perils of your suppliers, of bad actors, and the recognition by CMS and OIG that this always happens. When unfortunately this is when bad actors come out and they think they're not going to be identified or tracked down because of lack of resources, and they think they can come in and out of the system before being found. The OIG, because of data analytics and other things that they've embraced over the last 5+ years, they are much better, faster, and effective at going after this. And in particularly, independently verifying the identity of a company, a charity, or anyone else you contract with regarding COVID-19 is the onus upon you. You need to be extra diligent at this point because, unfortunately, the bad actors are popping up. They're trying to sell things that they either can't deliver upon, make promises that they can't deliver upon, or take your money and never actually deliver the service. That's scary, and that's something that is, probably not a surprise to you, but it's happening. And they're going at, there's enforcement cases already where they've gone after suppliers that have done this. There are some places and resources for you. We suggest you check the website and email address diligently of the people that are contacting you if you're not familiar with them. If the product is new to you or it's not a referral from a trusted source, you should be extra vigilant in that regard. This is where scammers often employ addresses that differ only slightly from those belonging to the entities that they're impersonating, and you get caught up in it, and they take your money and actually never deliver the service. So be very careful in reviewing website addresses, email addresses, office addresses. Look up the history of that company. Is it newly formed? Who are the officers? Are they associated with bad people? There are things you need to be more focused on in these days, unfortunately. They're going to come to you by unsolicited emails or calls offering supplies, and they're going to try to have you make a decision quickly. Better act fast. We've just found 100,000 masks that we didn't realize. The first buyer gets them. Those are the warning signs that it's most likely a scam. Do not click on links or open email attachments from an unknown source. Be very careful and look to see both at the website level that there's a secure lock in the URL that you're dealing with a trusted source. Do a little verification on whether that company exists at your Secretary of State, etc. before you do business, and certainly do not open up any link attached to an unsolicited email, because that's probably an attempt to drop malware into your system. So sorry to be a downer at a difficult time, but these are the times in which we really have to ratchet up our vigilance. There actually have been some warnings issued by the government. FBI is certainly going to be fast and furious on this, and they are warning of advanced fee and schemes related to procurement, like the one I was mentioning before. The act fast, hurry now, we're limited supplies. This is, an offer only offered to our most favored customers, and you're not even a customer of them. These are all the types of things that scammers are trying to get into. They advise, the FBI does, to look for this activity, especially when it comes into unusual payment terms, paying up front. You should never pay up front for these. And you should ask for and wait for proof of delivery before making payment. Any last minute price changes, cancel that contract on the spot. last minute excuses for delay. They're going to come up with all kinds of creative ways about it was seized at the port, or it's been manufactured somewhere else and it's not my problem, it's stuck in customs, but they've already taken your money, etc. The Department of Justice there's a link here to their website on a coronavirus response portal. This is designed to inform the public about these schemes, report price gouging and hoarding, and report those vendors up so that they can be added to watch lists and removed from the web as best the Department of Justice can do. So, Christine, if you don't mind, I think it might be helpful. We've covered a lot, but we also want to see what you're most worried about or focused. So, Christina?
Yeah, so which risks are you most focused on right now? We've got the poll open. If you guys wouldn't mind filling it out, I'll give it just a few more seconds here to let everyone kind of get their answer in, and then I'll pass it over to Mike to talk through what we're seeing on our end.
We got some activity here.
Mm-hmm.
All right, let's give it 5 more seconds. All right, voting is closing. Christina, what have we got here? So tell us about what you're seeing here.
Yeah, so it looks like, I'll share my results so that everyone can see, but it looks like we've got the biggest percentage of people are worried about coding and billing errors, but I would say that we've got a close second, third, and fourth here with third-party vendor management, primary source verification, and data and system security.
Yeah, this is very interesting, not surprising. What it tells me is you're worried about a lot of things, and there's a lot of water coming out of a hose at you at the moment. This is why enterprise-wide risk management is so important in your organization. And if you are not coordinating with and having regular, if not now, more frequent conversations with other stakeholders, not just compliance, if that's where you are, but on the security tech side, on the legal side, on the operations side, now is the time to do so, because this shows us that you're not immune to any one thing. I will say that we're going to talk about vendor management in a minute, but I do want you to realize there have been all kinds of malware and ransomware attacks on healthcare, and that is the focus of criminal organizations. There's a recent article posted from the FBI that the warning is that healthcare is the target now for all types of data. So let's change our focus for the remainder and then open up for questions and talk about the DOJ guidance that was recently released. So for those of you who sit in the area of risk mitigation or compliance, you're probably familiar with the principles of federal prosecution that the Department of Justice has over a business. Now, let me remind you that many things have been ratcheted up in the last 3 or 4 years, one of which is the increase in corporate integrity agreements, deferred prosecution agreements, but also requiring that management and the compliance officer sign personally attesting that what has been required of that company is being done. That now puts personal liability upon you, not just the CEO and or the C-suite staff who's going to press hard to make sure and audit that they can rely upon your certification of things. Why is that? Well, amongst the impetus for this is the ability for the government to go after and federally prosecute for false claims and other measures of your company. So they have issued, the Department of Justice, some guidelines on helping to give you more rubber that hits the road, I guess, on what they're looking for and how to determine whether or not you have an effective corporate compliance program. This is very helpful and instructive, because before it was a little loosey-goosey and there were lots of resources, some of which were binding and others were simply best practices, but it left the organization kind of trying to figure out which ones they should focus on or what was the DOJ looking for. Well, now they provided more guidance in this area. before they make a decision for criminal prosecution or a civil settlement, they've now issued these two new guidelines that you should take a look at. In section 928-300, they have provided some factors now to be considered in your effectiveness, what they're going to be looking to determine the effectiveness of your program. And these should be the model for which you are ensuring and certifying and auditing that is actually happening in your organization. That they're giving you the roadmap of how they're going to hold you liable now through these factors. And then in section 928-800, what is the overall corporate compliance program that they expect you to have? Now, the good news is that if you revise and maintain and build your compliance program to these standards, there is an automatic presumption when they show up that you have at least a defensible and effective compliance program. By not having this, the presumption is waived and they will go at it from the standpoint of what is listed here. So they're telling you what you need to do and giving you a presumption. If you have and follow, not just write and put on the shelf to collect dust, but actually follow and have policies and procedures and abilities to prove it, you also can have, on a criminal matter, your sentence reduced by 90%. And so there are lots of reasons you want to pay attention to what we're talking about. As we round out today's session, we do want to talk about third-party due diligence and ratcheting that up because of the bad actors. The Department of Justice in this section has given you things that you should be looking at. So the question is, how are you at your organization monitoring these third parties? If you don't even have a tax ID, don't know who the owners are, don't know anything about the business, that is not a good place to be today. And when or if reviewed or audited, you have some exposure with the Department of Justice and potentially a not effective program. So I would encourage you to look at your risk mitigation of third parties and make sure that you are doing a deeper dive on your suppliers and vendors. Lastly, evaluating the corporate compliance program, which we talked about. There are these three things we think you should keep in mind to avoid any type of prosecution and to get the credit your organization can have by adopting these. And you should ask yourself these questions, which the government will ask of you. Is the corporation's compliance program well designed? And if so, take a look at the guidance listed above. Is the program being applied earnestly and in good faith? In other words, is the program adequately funded, resourced, and known throughout the organization? And does the corporation's program work in its practice? Is it actually implemented, and can you prove that? So we're going to open up for questions. There is a resource page with lots and lots of links for you that we've referred to today so that you can go back and or pass them on. With that, Christina, I'd love to open it up if there are any questions from our audience today.
For sure. I've got a couple here, but looking at just the questions, if 43.5% of all Medicare primary care visits in April were telehealth, do you know the percent prior to February/COVID to compare that to?
That is a good question. I don't, but we're happy to try to figure that out. And we can respond back. This was an anonymous request, but if you would like specifically and you don't mind emailing us, we'll send that to you. I don't know the answer to it. Suggest that it's a significant increase for sure since prior to COVID.
All right, then to address a couple other questions that I saw come in that really are more housekeeping than anything and are my bad for not going over at the front end of things. Everyone will be receiving these slides and recording from today's webinar, and the webinar is available for CEUs. We are waiting on the certificate from the CCB, so you will receive all of those things after today's webinar.
Excellent. Well, we want to respect your time and hope that you go out and make it a great day. If you're on the Gulf Coast, stay safe. We hope this was helpful. If there was an area that you would love us to cover, we didn't. We're always open to suggestions to make these better. There's so many things we could have covered, but tried to pick the big big ones to make sure that we covered across the organizations that are on this call, and wish you very well today.
And if you wouldn't mind just sticking around after the webinar and filling out the survey that will be sent to you, it helps us keep our webinars relevant and timely. So with that, we will call it a day. Thanks so much, everyone, for being here with us.
Thank you.